Hello, ladies and gentlemen. My name is Aaron Cohen-Gadol. I'm a neurosurgeon. I've been involved with the management of brain tumors for many years. And today I wanted to talk to you about the process and indication for stereotactic brain biopsy. And so this is one that can be a little bit confusing. Most often we remove a brain tumor when it's diagnosed as safely as possible. However, there are times where a tumor cannot be removed or its location would not make it possible to be resected completely or be even accessed safely. In these situations, we want to at least confirm what kind of tumor we're dealing with so we can treat the tumor through other means than surgery. So let's define what's a brain biopsy. It's a procedure to obtain a small piece of tissue of the tumor from the brain for further microscopic analysis through the pathologist to be able to see exactly what we're dealing with. Because on MRI, we see a tumor. Its characteristics on imaging can tell us potentially what we're dealing with, but we can never be sure 100% until we have a piece of tumor under the microscope looking at it and confirming its real diagnosis. So what are the indications for a stereotactic biopsy? It determines the exact diagnosis, as I mentioned, of an unidentified mass found on imaging, most often an MRI, and we're able to identify the type of the tumor and how aggressive it is. And based on these characteristics, we can design a treatment that's most effective. It's a minimally invasive procedure. It's performed with a coordinate-based navigation system. In other words, it's a computer system in the operating room that would allow us to localize any position on the MRI to the position in the brain. And therefore, we can be very accurate to get the biopsy specimen from the location within the tumor and not part of the brain that's normal. The system is equipped with a patient MRI or CT scans to guide the placement of the surgical instrument or the needle to take the biopsy. There are different types of stereotactic biopsy systems. There's one that's framed stereotactic biopsy, which requires a frame to be placed on the head of the patient through small pins just purchased the outside of the skull bone. This is the most accurate method to be able to target a point in the brain of the patient. Or it can be done frameless, or a frameless stereotactic procedure. And no frame is required during surgery, so it's more comfortable for the patient. And it's a newer method. It's a GPS-like system to navigate. Its accuracy is not as perfectly as accurate to a frame stereotactic system or a framed stereotactic system. However, it is accurate enough for most lesions that are larger than a certain size. So you may want to know who performs a brain biopsy procedure. The stereotactic brain biopsy involves the use of a neurosurgeon with his or her expertise to conduct the procedure. After you see an oncologist, internal medicine doctor, and neurologist, they may recommend a biopsy, or the neurosurgeon himself or herself may advise that removal is unsafe, we're not sure what the tumor or other lesion or mass in your brain is, and therefore we want to confirm the diagnosis. The procedure involves obtaining the tissue specimen, and the tissue specimen sent to a physician called a pathologist that specializes in the examination of the tissue and final diagnosis. The specimen is, as I said, examined carefully under microscope, and the report is sent back to the neurosurgeon or any of your healthcare team to know what the diagnosis is and what the pathologist has found. And then analyzing the tissue on the microscope is really the critical component of this process, especially knowing how aggressive the tumor is. Is it benign? Is it relatively benign? Or is, God forbid, unfortunately aggressive or cancerous? It may take up to a week for the results of the biopsy to come back. So you have your procedure, you go home and get the results a week later. So what happens before the biopsy? So 1 week before the surgery, all the blood thinners are stopped, all the non-steroidal anti-inflammatory drugs are stopped, so the risk of bleeding is minimized. Several days before surgery, typically examination is done and other tests may be performed by an internal medicine doctor to make sure you can undergo anesthesia. Most often the biopsy procedure is done with you under general anesthesia, and the length of the procedure is relatively short, under 1 hour. The night before the surgery, your physician may ask you to fast to prevent vomiting while under anesthesia or aspiration. You may be asked to shower with an antiseptic shampoo the night before the procedure. So what happens during the biopsy? One of the steps involved obviously induction of anesthesia, so you will not feel the pain, and the patient's head will be shaved in just a small area, and it can happen anywhere in the head, where the small incision is created after the fixation device is applied to the head of the patient. So the head of the patient does not move during the surgery. Once the fixation device or the clamp is in place, the coordinates from the MRI are registered to the head of the patient. When the register is complete, the needle can be moved and tracked on the computer screen in real time to see where the incision should be made on the scalp. So the second step is incision and the burr hole. A small portion of the patient hair, as I said, was shaved at the beginning of the procedure. The scalp is incised 1 or 2 centimeters in maximum length, and a small hole is created on the skull using a medical drill to be able to pass the needle through the brain to the target. This small hole is called the burr hole. The needle is advanced through the computer system and the frame coordinates and the stereotactic guidance, and the surgeon will be able to see where exactly they are in the brain in real time to insert the biopsy needle through the burr hole at the right appropriate length, angle, and trajectory. The surgeon will then obtain the tissue sample through the needle. Next, or step 4, the specimen quality is checked in the operating room. While the patient is asleep, the tissue sample will be sent to the pathologist or neuropathologist immediately for an initial evaluation to ensure that the tissue is usable and it's diagnostic. If the tissue sample is confirmed, the surgeon will obtain a few additional samples to send to the pathologist. The final step, or step 5, involves that once the sample is removed, a small metal plate will be placed on the hole in the skull with the screws to cover the defect, and the skin will be closed with staples or stitches, and bandages will be applied, and you will be awoken from anesthesia and transferred to the ICU or regular floor. So immediately after surgery, you are taken to the recovery room for monitoring. The pain is common and is controlled with medication. Several days after surgery, you have to have certain instructions to take care of yourself at home, but most often the patients stay in the hospital for 1 or 2 days and CT scan may be performed. So really the procedure requires an overnight stay in the hospital. At home, please follow instructions provided by your surgeon. You typically can take a shower 2 days after the procedure, but do not brush over the incision directly, but you can brush everywhere else, and the incision can get wet. Regarding your activities, avoid strenuous activities such as jogging, avoid risky behaviors, do not drink alcohol or use nicotine products. Try to take walks 5 to 10 minutes daily, frequently, and increase the frequency and the period of the walks gradually. Try to sleep with the head elevated if possible. You may apply ice pack for 15 minutes to reduce pain and swelling to the incision, and try to drink water and eat food high in fiber to resolve constipation caused by the anesthesia and narcotics. As I said about the incision care, you can shower about 2 days after surgery. Wash gently the incision site with soap and water daily. Avoid hairstyling product, lotion, or baths for at least a month after surgery. You can use acetaminophen or Tylenol to control the headaches. Avoid the use of non-steroidal anti-inflammatory medications such as Advil and blood thinners for at least a couple of days after the surgery, but please consult with your surgeon. If you have any fever, chills, confusion, headaches, swelling, bleeding, or increased pain around the incision site, please inform your surgeon right away. Of course, excessive sleepiness, confusion, headaches, weakness in arms and legs, or any other neurological symptoms should be reported immediately. What are the complications from a brain biopsy procedure? These procedures are extremely safe, 95% safe, but in less than 5% of the time, bleeding can occur and can be significant. The bleeding in the brain can cause new neurological symptoms, and other medications obviously can have side effects as well. But the major issue with biopsy procedure is bleeding in the brain, but it occurs in a very rare situation. The brain biopsy outcomes are usually very favorable. This is a minimally invasive procedure. In most cases, patients can return to normal activity within a week reasonably well, and at the next visit, once seeing their surgeon, other questions can be answered. So overall, it's a very minor procedure in the overall armamentarium of the neurosurgeon. It's very safe, it's effective, over 95% of times a very realistic and appropriate diagnosis can be achieved, and therefore please follow the instructions of your neurosurgeons regarding this procedure. Again, thank you for being with us today, and feel free to reach out to me if you have any questions. Thank you.